We do a lot of rule-out type of work. Patients that may come from the emergency room with like the chest pains, or maybe even same-day procedure patients that will go to surgery, come up and do some recovery, or spend a night or two and then go home the next day. Depends on the role you're in, if you're the charge nurse or if you're working in infusion versus working just on the floor. There's lots of things, lots of IV starts, lots of medications to give, treatments, testing, that type of thing. I think sometimes knowing what you're doing is the best that you can do at the time, but maybe at the end of the outcome it's not gonna matter. I think that's the struggle. Like, you always want to help people and do the best that you can. You know, the hard choices, I think, are something that I wish that patients would get a little more education or talk to a little bit more about it, like end-of-life care or futile treatments for certain cancers or things like that. It's a difficult thing. I think the best part, what I found working now in an area that's closer to where I grew up, is coming across people I know, or they know somebody I know, finding something in common, and that helps them relax, and you have something to talk about. Just building a relationship with patients and families, and knowing that what you're doing is making a difference. I had taken care of a patient, and he had had a surgery a few days before, came back not feeling real well, maybe not sure what was going on. Well, here it was found there was a complication from the surgery, and he had a lot of blood bleeding into his belly. I recognized the fact that he was going downhill fast and that he needed intervention quickly, otherwise, and the patient said to me, "I'm dying," called his wife and said, "I'm dying." So we had some discussions with doctors and got him into emergency surgery. She came back to the floor. Well, the surgeon actually came back to the floor and thanked me and told me what happened, and then she came back after that. So knowing that, and then I went out and seen him in ICU later, so it was kind of, I guess, a big deal. He was happy to be alive. Family was very grateful.